Welcome back to Did You Know, a podcast by Partner Veterinary. In this series, we will explore all things veterinary medicine and all things partner. In each episode, we will answer some of the most common questions we are asked. From HR to emergencies and everything in between, if it happens at Partner, we'll cover it. Speaking of emergencies, in this episode, we hear from Dr. Rachael Boyd, Partner's lead emergency veterinarian in our Richmond location. Dr. Boyd gives us an in-depth explanation on Partner's triage process, the order of treatment that dictates how patients are prioritized in our ER setting.
I'm Dr. Rachael Boyd. I'm a 2015 graduate of the Virginia, Maryland Regional College of Veterinary Medicine. I've been practicing ER medicine exclusively since graduating, so about 10 years now. And I have a focus in trauma medicine, and I currently am the lead emergency veterinarian at Partner. And what that entails is basically advocating for my DVM team, making sure that we can communicate and work well with the specialists who are at our hospital, and that we all have the resources to work appropriately with our team that supports us and our patients every day.
Thank you so much for joining us, Dr. Boyd. Partner has a triage process at the hospital. Can you explain what the triage process is and how it works?
Yeah, so triage in its most basic form is completing a brief assessment of the patient in front of you in order to determine how urgently they need to be evaluated fully and receive treatment and intervention. So at Partner, our triage process is performed by our ER team. When they go in, they collect a history on the patient, because often history is actually half of the equation for us. And then they'll assess a patient's vital signs. So that includes heart rate, breathing rate, and the effort in which they're using to breathe, the patient's temperature, and some perfusion parameters like how strong their pulses are and how good their capillary refill time is. So all patients have those vitals assessed with their history, and then they're able to determine how urgently that patient needs to be seen by the medical team.
And what are the different levels of our triage process, and what do they mean?
Yeah, so here in Richmond, we have 5 levels of triage assessment. They are labeled in order that those patients need to be seen. So our triage level 1 is the patients that need to be seen first by the medical team, whereas our triage level 5 are the patients that need to be seen last by the medical team. Triage score 1 are the most severe patients. They are really on an imminent risk of death. These patients are usually struggling to breathe. They may require CPR or some stabilization measures like getting their blood pressure up. So these are the most critical patients who often present to our hospital limp, unable to lift their head, things like that. Level 2 triage patients are patients whose condition requires pretty urgent intervention, or it could decline really rapidly. So we often consider patients who've been bitten by snakes level 2, because snake bite patients can be stable initially, but then can decompensate very quickly. Patients who've been hit by a car sometimes can be level 2, depending on the strength of the impact. Allergic reactions or toxin ingestions, those can be considered level 2s as well, depending on how the patient presents to the ER. Level 3 patients are sick, but for whom the next few hours are not going to change the course of their illness. So a patient who's been vomiting pretty profoundly all day, they're mildly dehydrated, they do need probably some fluid therapy and some medical intervention, but if they do have to wait in the waiting room for 6, sometimes 8 hours, it won't cost them their life to do so. Level 4 are patients who really have no risk to life or limb in the immediate 24, sometimes even 48-hour period. And then level 5 are patients who can be seen probably within the next several days, whether by us, by their primary, or by an urgent care veterinarian.
That's really helpful, going through the chart and giving examples of each. I think that's very helpful. Is the triage process something other veterinary emergency hospitals employ?
I think to some extent, almost all ERs use a form of triage. They're going to get the history on a patient, for example, a male cat who hasn't urinated in a long time or is straining. They're going to know that that's likely to be a cat with a urethral obstruction, and that's going to move them to the beginning of where their priority on patients. The difference in partners is just that we have it very clearly defined. And so not all ER facilities are going to have quite as strict of a protocol for which patients fall into which triage level, which types of vital changes and parameters qualify them for which triage level. And those triage levels being so clearly defined help our medical team make sure that we're providing the patient care to the patients who need it most first.
How is this beneficial to the pets we care for?
One of the things that everyone has experienced probably in the last several years is that the ER departments can become very overwhelmed with the amount of sick pets that are here in our country in general, but Richmond, particularly where our hospital is, faces that a lot. And so they may have to close their doors to receiving additional patients, and patients may have to drive several hours to receive care. Our priority is to try and assess where our patients are in their triage acuity so that we can make sure that patients who can't make a drive or who can't wait for any further care can receive the care they need. And that means, unfortunately, that some patients will have to wait a very long time in order to get the care that they need if they have an ear infection or a urinary tract infection. But what it does mean is that we try and prevent pets from suffering or even passing away in transportation to a hospital that's much farther from us, because that happens every day right now in this country because of the fact that ERs just can't handle the volume of sick pets that are present.
And that's, one of my questions was going to be, how does this affect wait times for people? Because we do have patients or clients who come into the hospital and end up waiting a long time, which is hard for people to have to wait. But it makes sense that if your pet is not as urgent as others, that you might have to wait. And how do you explain this? And how can people understand when they come in how they're going to be put through the triage process and what they can expect?
Yeah, we try and be really clear with people once they've been assessed and we've looked at their pet's vitals, where they fall on the triage acuity scoring system, so that they can have a better idea of kind of the prioritization of their patient. Now, sometimes people worry that means, okay, my pet is a 4 or a 5. That means they're not important. And that's not true at all. We want to get those pets taken care of. We want to get them the pain control, the antibiotics, whatever treatment it is that they need. But we can't sacrifice the life or the well-being of another pet in order to do that. And so what that means is that pet may just have to wait. That owner may have to wait. We're fortunate that our hospital is in a pretty busy area of Richmond. And so we often will encourage clients who have a more stable pet. They can sometimes go home for a little bit. If they live nearby, they can go to a local restaurant, and we're happy to watch their pet in the back. We want to make the waiting experience as comfortable as we can for you, because it can be very long, but we have to make sure that the pets who need us right away, that we have the availability and the staff to do that. And that means, unfortunately, delaying care for some of the patients that can wait.
What would you say is the most important thing clients should know and understand about our triage process?
I think one, understanding where you are in it can be really important, because we do have an excellent set of urgent care veterinarians in Richmond that may be opening up, shortly. If you come in, you get your vitals assessed, and we say you're a 4 or 5, and our wait is going to be 8 hours, it may make more sense to go to a different urgent care vet where you can be seen a little bit faster. And we won't begrudge anyone for that, because if we're on that extended period of a wait, our staff is focusing on the pets that need the emergency room treatment that we can provide that an urgent care can't. And so that's perfectly fine. The other thing I think clients should recognize is that your triage acuity score can change. So if you come in and your pet is assessed at a 3, and you feel during the time that you've been waiting that your pet has declined, that they're more lethargic, that they're just not doing well, something's not sitting right with you, please alert our team, because we can actually change your triage acuity score based on changes to their vital signs or how they're doing in our hospital. And that's really important. So keeping that line of communication open with your medical team is a really, really important part of triage, and the owner is part of that.
That was really, really helpful. Thank you so much for taking the time to go through this with us, Dr. Boyd.
Yeah, absolutely.
Thank you for listening to Did You Know? Is there something about Partner that you want to know? Email us at letstalk@partnervesc.com. Who knows, we might turn your question into an entire episode. You can now find us wherever you listen to all of your other favorite podcasts. Subscribe now.